56 past 5. What a different morning it is this morning. No sunrise, just cloud and some rather large swell. I do miss my daily surfs with this elbow fiasco. I want to talk a little about that. Yesterday I mentioned the surgeon giving me a report that I wasn't really impressed with, and whether you believe your doctor or your surgeon. So I want to explain a little about Australian healthcare. Now this is a detailed discussion, so I'm only going to hit like key points. Here in Australia we have free healthcare for all. It's called the public healthcare system. You can, like if you have an accident like I did, you can just walk into a hospital with a card. It's called a Medicare card, and you can be seen by doctors based on the urgency of the accident. I mean, this is not classed as very urgent. If I was in the hospital and a car accident happened and then there were 4 people coming in, they would get priority. So you get seen by doctors in the hospital, you get treated by doctors in the hospital. There's the option in Australia to also have private healthcare, and that's additional, like you pay for that yourself, and that gets you, well, I'm not 100% certain what it gets you, but I know it gets you faster access time to possibly better surgeons, and it gets you access outside of the hospital system, so you can go and speak with private doctors and private surgeons and possibly get treated better. I'm not 100% certain. I think that's how it works. I don't have the private insurance because man, the surf is right out there. I don't have that private insurance. I just have the public insurance. The issue I had with this scenario from a couple of days ago, 6 days ago now, is that when I went into the hospital, they ask you, do you have private insurance? No, I don't. I'm on the public system. Okay, cool. Then, after I got my bone popped back into position, the doctor in the hospital referenced me to an orthopedic surgeon and didn't tell me that he was putting me out to a private surgeon, and therefore there'd be cost involved. So when I rang the surgeon to book, we went through the booking process, yada, 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 yada. Then the surgeon's front desk said, oh, and there's going to be X amount of money to pay. I was like, whoa, hang on. I'm not privately insured. I'm in the public system. Oh, well, we don't do public patients. Well, then why would the hospital send me there? Why would the hospital say you need to go and see this Dr. Jarman if I'm not a private patient, I'm a public patient? And so my frustration lies that I had to go for this urgent surgery, and I had been sent to this guy. I later on found out I was sent there because he's the only guy in town. Turns out he's not. There's 4 or 5 different orthopedic surgeons down in this Shoalhaven area. So what I'm getting at is that this terrible triad injury could have been rebuilt and reset and redone the night I was in the hospital, but now it is 6 days later and I've got to go 2 hours up the coast or an hour up the coast to Wollongong to be seen by a public surgeon to get it fixed. It's kind of frustrating. And there's no sunrise. And that's why I'm a little bit angry, because it's almost healing and I've got to go and get it rebroken, got to get the surgery done, and I feel like it was